All right, thank you, Evan. It's 6:42, live on 8 this morning. We're pleased to be joined by the owner of Teton Medicare, Lee Wilson. Thanks for getting up early with us this morning. Now, the one question that I wanted to ask you this morning is, some people get confused. A lot of medical terminology sounds similar. So the difference between Medicare and Medicaid, can you clear that up for us?
Absolutely, great question. So Medicaid is a state-run benefit. Normally, your eligibility for Medicaid is determined by your income, but you can be young, you can be old. Your income generally dictates whether or not you're eligible for Medicaid. Where Medicare is a federal insurance program, if you get a paycheck, you're paying Medicare taxes every time you see that paycheck. That's going towards that Medicare, that federal health insurance that someday in 45 years from now you'll be eligible for. So that's a federal insurance program that everyone gets. Sometimes you can get that a little early if you're on Social Security disability, but generally it's at 65.
All right, you're too kind. It's going to be much sooner than that for me, but I appreciate it. So Medicare enrollment, is it automatic or kind of how does that work?
Great question, for sure. So it can be automatic. If you're receiving Social Security benefit checks at the time you turn 65, then your Medicare enrollment is automatic. Some people will put that off if they're going to, keep working past 65. The other time it might be automatic is if it's, again, someone's on Social Security disability for 2 years, then Medicare understands they need that and they're automatically enrolled into that before 65.
Now, where does Teton Medicare come into the picture for this?
Great question. So Teton Medicare, we want simply to educate our community as far as when it is appropriate to get on Medicare, what's automatic, what's not, what Medicare is and what it isn't. There's just so much noise and confusion around Medicare. We want to sit down with people and say, here's really how this works. Here's how this impacts you. Here's what it costs you. And we like being the local agent, right? So your viewers right now, they trust you, Dylan, as a local expert, giving them local context. That's exactly what we do at Teton Medicare.
So when people come in, what can they expect? What do they need to know?
They can expect zero pressure from us. We really just want to educate. We have male agents, female agents, English, Spanish. We just want to go through with you and help you understand exactly what you're eligible for to help you get the most out of Medicare. We also want to make sure you can avoid all of the nonsense. There's a lot of fraud. There's a lot of misleading information out there. If we can avoid all that nonsense, keep it local and keep you on the right path, that's really what we want to do.
Yeah, it can be hard and intimidating to kind of figure out what exactly going on. So.
Absolutely.
All right, Lee, thank you so much for joining us. We look forward to having you be with us next Tuesday on Live on 8. All right, coming up, well, the Madness of March is about to start, and you have the chance to win if your bracket doesn't get busted. We'll tell you how you can play when we come back.